All right, today we're going to talk about a word that, let's be honest, sounds a little complicated, maybe even a bit scary: hypercementosis. But you're going to want to stick around because this is the perfect example of a medical term that sounds way more serious than it actually is.
You know that feeling, right? When you hear a long technical word from a doctor and your brain just immediately goes to the worst possible place? Yeah, we've all been there. Well, today, we're going to pull back the curtain on one of those exact kinds of terms.
So let's get right to it. What in the world is hypercementosis? We're going to strip away all that clinical sounding language and get right down to what it really means. Okay, so here's the official textbook definition. All it's saying is that there's a little extra buildup of something called cementum. And cementum is a completely normal tissue. It's this hard, calcified layer that covers the root of your tooth. It's supposed to be there. The hyper part? That just means there's a little bit more of it than usual. That's it.
I love this analogy because it just makes so much sense. Imagine the root of your tooth is like the root of a tree. That cementum is its protective bark. So hypercementosis, it's just a spot where the bark grew a little bit thicker. See? It's just an excess of a totally normal, healthy thing.
So, okay, if a dentist sees this on an X-ray, the next question is obviously, well, why is it happening? It doesn't just pop up for no reason. Turns out the answer often comes down to a few potential triggers. Think of them like clues in an investigation.
And as you can see from this list, hypercementosis is often connected to other things going on. Sometimes it's something very local, like some stress from how your teeth bite together or some inflammation nearby. But it can also be a little flag for bigger systemic conditions. The key takeaway here is that the hypercementosis itself isn't really the issue. It's more like a signpost that might be pointing to something else.
So how do you even find out you have this? Well, you won't feel it. You're not going to see it in the mirror. Hypercementosis is almost always an accidental discovery, something your dentist just happens to spot on a routine X-ray.
So on that X-ray, your dentist is kind of playing detective. They're looking for these very specific visual clues. They might notice the ends of the tooth roots look a little thicker, maybe a bit more rounded than they should. But, and this is so important, the healthy lining and the space around that root are still perfectly fine, totally intact. And that's the dead giveaway that tells them it's hypercementosis and not something else to worry about. And this visual just lays it out perfectly. On the left, you've got your typical smooth, pointy tooth root. And on the right, see that? It's that subtle thickening, that little bit of blunting right at the tip. It's not some crazy change, but it's the exact visual cue a dentist is looking for.
Okay, so we know what it is, we have an idea of what might cause it, and we know how it's found. So naturally, you're thinking about the treatment plan. I mean, especially after seeing that long list of potential causes, you might be gearing up for some complex solution. Right? What now? What's the protocol? Is there a special procedure, some kind of medication, a whole series of appointments? What do you actually do about it? The answer is nothing. Absolutely nothing. Yup, you heard that correctly. In the vast, vast majority of cases, the treatment for hypercementosis is for your dentist to simply make a note of it in your chart. That's it. The condition itself requires zero intervention. It's benign. It's not a threat. It's just a variation of your normal anatomy that's interesting to document, but it's not something that needs to be fixed. It really is the perfect example of a medical finding that's more of a fun fact about you than a frightening diagnosis. And that really leaves us with a final thought to chew on. It makes you wonder, doesn't it, how many other intimidating medical terms or complex-sounding diagnoses are out there that, once you actually break them down, are way simpler and a lot less scary than they first appear. It's just a great reminder to stay curious and to always, always ask questions.